Most of you know that physicians that are cash pay tend to be higher quality and even better value. But what most business owners don't realize is that you can actually use cash pay services for your health insurance benefits as well.
One of our favorite examples just happened here in little town in Ohio, where a small business of only 24 employees was able to save $96,000 utilizing that.
So I want to show you how they did that. There's really only three big buckets when it comes to your health benefits. It's the primary care, it's the pharmacy, they call them PBM, pharmacy benefit managers. They're really a middleman between the pharmacies. And then also the hospital contract, some sort of network that you use, right? So we'll call that the hospital here, right? And so what we've done is we've been able to work with local advisors, and there's advisors across the country that are doing this. And they are setting you up with direct cash pay providers. That's what we do here. PBMs that are independent cash pay pricing. That's what you've probably heard of. Mark Cuban has done cost plus drugs, where they only mark up 15% versus like a small business probably getting marked up 200-300 times what a pharmacy cost should be. Then you have hospital contracts, which typically are in the 700, 800, 900% of Medicare markup, whereas we have contracts that are in the 180 to 230%. Big numbers, but that means how much are you getting dinged for a knee replacement, a surgery, an ER visit. So all of those are ways to utilize cash within your health benefits.
And I think the most important thing is, again, if we can wrap all of this around excellent primary care. Primary care should be able to contain, and has been shown to be able to contain, 85% of the costs in any given health plan.
And so what that ends up looking like is your health benefits really are only about 5 or 6 pieces of one puzzle. And so when we put what we call direct primary care, where you're paying a per member per month fee, that's a fixed cost that should cover about 85% of your healthcare needs, right? Telehealth, texting, weekend calls, that should be at the heart of your health benefits. Then you plug in your pharmacy benefit manager. Then you plug in those hospital contracts. Then you plug in your TPA, it's called a third party administrator. Then you plug in your stop loss. Now this is what something we call the BUCA plans for Blue Cross Blue Shield, United, Cigna, Aetna, Humana are all doing these things, okay? We've got our pharmacy here, right? We've got our contracts, right? They have done this for you, and you get this package plan, but they control every piece of that puzzle.
Which is why we're telling you that it's actually riskier as a small business owner to be sticking with a BUCA plan, your Anthem, your Blue Cross, your United Healthcare, because they control every aspect of this. So even if you have a really healthy year, they can say, oh goodness, you had a pharmacy cost that was really expensive, but they controlled the cost. So this is why, as a small business owner, we must be thinking, how can we separate this? How can we divide this up? And there is a way, and that's what we're here to tell you.
So the goal is just bringing back capitalism, cash pay, to each of these pieces of the puzzles. Independent groups that have to do a really good job or they get fired. They have to bring value to the table. They have to serve you well. They have to show you that they're providing an ROI to your company, or they're out, right? And so now we have an independent package that's all together. You still don't have to do anything other than make good decisions, but it's all, independently working together for your benefit rather than being controlled.
Again, this is what we do every single day. If our patients don't like what we're doing, they fire us. The same goes for the small businesses that we work with. If we're not doing our job in healthcare, they say, you know what, we're out of here. We don't want to pay for your monthly fee. And again, it's just a way of getting out of that system and again, lowering your overall risk.
So we're all incentivized to provide value to lower your costs rather than to increase profit to shareholders. Now, how you do that is we can send, so there's various resources, advisors that are doing this across the country. Health Rosetta advisors are really kind of the best ones that we found. And so you can search for that. There's direct primary cares across the country. dpcfrontier.com is a great resource for that. We'll post those in the comments below.